Pain relief, absolutely, is the biggest thing I'm looking for. I have a lot of issues with fibromyalgia and arthritis, so I wanted to be able to get some pain relief to be able to get off more of the pain medications I'm on. I have one specific nerve that seems to give me the most headaches, and medications don't take that away. It's really hard to make that specific pain go away.
We came out to Chandler today to the Novocur Pain Management Clinic to meet with Dr. Alex Bigham. Hi, good to see you again.
Hi, thanks for being here.
Well, thank you for inviting us because you're showing us a very unique treatment that you perform here. Tell me what it's called and what does it do?
So the treatment today is called radiofrequency ablation, and in this particular application we're doing it for somebody that's had chronic migraine headaches. And so for some people, a more conservative approach, an injectable approach, provides good relief, but only short-term relief. And in the instance of this patient, she's getting a week or 2 weeks of relief from her headache, from her migraine headache pain, and that's good, but it's not long enough. So then what we can do is, now that we know that we've targeted the right tissue that's generating her headaches, we're going to do a treatment with the radiofrequency ablation that's going to provide more like 6 to 18 months of relief, and that's going to give her a much longer benefit.
What do you mean by ablation? What is exactly happening here?
So we're heating nerve tissue is what we're doing, and basically what that does is we heat it to the point where the nerve is unable to continue to send pain signals from her head to her brain. So she's never going to receive the signal of, ouch, my head is hurting. And it takes about 6 to 18 months after we heat that nerve tissue for the nerve tissue to begin functioning properly again. It gradually heals up like all tissue in our body does, and when that happens, it'll start registering as pain again, and then we can do it again.
Okay. Now, I think we've all experienced intolerable, unbearable pain at some point in our life. Who's a good candidate for this type of treatment?
Well, anybody that's experienced long-term migraine headaches where they've failed medication management or other more conservative types of treatments such as physical therapy, chiropractic, acupuncture, massage. Of course, we can apply the same technology to multiple other types of conditions such as chronic back pain, chronic neck pain, and we're actually the only pain management facility in the Valley offering this for chronic knee pain actually as well.
What type of results can somebody expect from this treatment?
The results are going to be pretty reliable. As long as we determine that they're a proper candidate ahead of time, the results are very reliable, 6 to 18 months of relief regardless of what part of their body that we're focusing the treatment on. So reliable results.
Another benefit besides no pain is that they're able to actually go off their medication for a while and give their body a break.
Right, and I know that's one of the goals that Elliot has, is that she is on some pretty powerful pain medications and she's wanting to get off those at this point, and we're going to help her do that.
What about side effects?
Well, with this particular treatment, radiofrequency ablation, they may have some discomfort in the area for anywhere from a day to possibly even 2 weeks following the procedure, and it's a feeling of kind of like a sunburn in the area of application, but most people don't feel any side effects at all. And so this is a very safe treatment with a very minimal downside.
And is it covered by insurance?
It is. It's covered by every insurance.
Okay. All right. I think we should go find out how Elliot's doing.
All right, let's do it.
Not a lot of pain, just the poking from the needles, but I get complete relief as soon as I'm done. I mean, I've had enough procedures here to know what it feels like. When they do a new one, it is a little bit nerve-wracking, but it always comes out pretty much the same. You go in a little bit of pressure, a little bit of pinching, and then you come out. There's no pain. I bet you in about a week I will have been pain-free for days and just really happy.
Who performs these treatments?
Well, you just watched Dr. Thacker perform this treatment on Elliot, and Dr. Thacker is an anesthesia-trained pain specialist. So after his anesthesia residency, he did a full year of expert training in all of the different types of interventional pain treatments, and that's typically the type of provider that will provide radiofrequency ablation.
All right, and tell me the name of this treatment again.
Radiofrequency ablation.
Okay, and it's only at Novocur Pain Management Clinics. They have 2 locations in the Valley. For more information, you can visit novocur.com or call them at 480-855-NOVO, which is 480-855-6686.